Hello, I'm John McCarthy. I'm the Vice President of Global Digital with AstraZeneca.
Hi, I'm Elizabeth Egan from AstraZeneca, Executive Director of Global Digital Strategy and Innovation. Really excited to be here in Cannes with the Advertising Research Foundation.
I'm Mark Rappin, the Chief Marketing Officer of the ARF. Let's jump right into it. I mean, I know you guys have spoken and we talked a little bit on the phone. You've spoken out about how patients are kind of ahead of the pharma companies in terms of technology and the technology. The pharma companies need to get more patient-centric, I think is the word that you used, Elizabeth. Talk to us about the kinds of things that you're doing, the Living with Cancer project and things.
Great. Yeah, we'll pick on my favorite child straight away. This is a wonderful program. We set out basically to find the problem behind the problem in lung cancer, and what we found was that people really suffered from the stigma of having the disease, which was almost worse actually than having the disease itself. Yeah. And what we very proudly created is an ecosystem to surround patients and caregivers and supporters with help. And actually what we also found is that whilst technology can really help us do this, not everything is about technology. Some people wanted, a newspaper, some people wanted to come to a live event and meet others with the same condition. Some people wanted to connect with other caregivers and so on.
So you needed to be multimedia almost.
Absolutely.
Terrific. And John, you're coming to us right from speaking on all of these issues earlier today, combining AI and all the mobile tracking devices that we're carrying. How is technology sort of really changing the interaction between pharma companies and the consumer?
Yeah, and I think, building on what Elizabeth said, like the people that we serve that are taking our medicines, right? They're living in a world where the technology is being integrated into all sorts of other parts of their life.
Right.
And I think the great example was the partnership that we've established with Babylon Health, and they've got a platform to deliver healthcare and really to help democratize the delivery of healthcare. So it is an AI platform leveraging things like Skype for doctor interactions, but also an intelligence component that allows for diagnosis. I see that healthcare is moving in that direction.
Technology is having a huge impact on insights. How is big data? Are you combining data sources? What are you doing to get more patient insight as you move AstraZeneca more patient-centric?
So we are examining how we utilize data, append data, and have a good approach to doing that that's well within the bounds of privacy and safety.
August 8th, we're having an event, an ARF event on patient journey research. It's much more complicated and involved today, isn't it?
Absolutely, yes. At AstraZeneca, of course, we have a great understanding of the treatment pathways that people go through, but we're massively into deep ethnographic research.
What kind of methodology do you use for the ethnographies to sort of get around?
Well, we actually recruit people through third party and actually, go into their homes and basically move in. Hey, what's in the fridge? What's going on with your kids? What's going on with your stresses and strains of everyday life, and really get an understanding of people.
What are the advancements that you think are going to happen in the next couple of years in advertising or marketing or measurement?
I think advertising is important, and we won't stop doing that. But I think if you look at other industries that are really growing, they have discovered that actually a service mentality to the people that they're doing business with has actually advanced them perhaps faster than and earns them the right to do the advertising.
Are there more similarities or more differences as you move communication and patient experiences to different countries and different markets?
More similarities than differences, I would say. There will always be local nuances and regulatory differences and legal requirements, but people are people and have the same struggles with diseases. Yeah, so we just want to do more of it, do it bigger, better, scale it around the world.
Terrific.